PDI, a company dedicated to developing the most advanced line of one-step infection prevention solutions, brings you the world's first continuously active, ready-to-use disinfectant that protects your patients and staff for up to 24 hours. Sani-24 Disinfectant is a revolutionary product that protects against epidemiologically important pathogens, escape pathogens, responsible for over 40% of hospital-acquired infections, or HAIs, for up to 24 hours. Sani-24 Germicidal Disinfectants help break the chain of surface recontamination and reduce cross-contamination on high-touch surfaces for up to 24 hours with its continually active disinfectant technology. PDI is now introducing Sani-24 Germicidal Wipes as an addition to this innovative offering. With Sani-24 Germicidal Disinfectants, there's no need to mix or measure. It's ready to use. It's effective against 26 epidemiologically important pathogens with a 1-minute contact time. Sani-24 Germicidal Disinfectants also provide continuously active disinfection with a 1-minute contact time to protect against pathogens responsible for a significant amount of HAIs for up to 24 hours or 96 touches. In this video, we will show you steps for using Sani-24 Germicidal Wipes for disinfection, continuously active disinfection, and prevention of mildew on hard surfaces. When using Sani-24 wipes to clean and disinfect blood and bodily fluids, be sure to wear gloves and other personal protective equipment as appropriate. Step 1. Prepare the canister. Always dispense wipes through the canister lid. To prepare the canister to dispense the first wipe, find the center of wipe roll and then thread through the large opening in the canister lid and pull about 1 inch and replace lid. There's no need to mix or measure. The pre-saturated wipes have the correct amount of germicidal solution, saving valuable time. Step 2. Dispensing the wipe. The lid has 2 openings, allowing for easy dispensing of a single wipe or multiple wipes at a time. The small opening allows for single wipe dispensing, while the large opening allows for multiple wipe dispensing. To dispense multiple wipes, open the lid and pull the wipe into the large opening to freely dispense as many wipes as needed. To tear the wipe, cover the opening halfway with one hand. Pull the wipes with a uniform pull out and away from your face and eyes toward the small opening, and the wipe will tear at the next perforation. Close the lid so it snaps shut to prevent moisture loss. To dispense a single wipe, cover the opening halfway with one hand and pull the wipe with a uniform pull out and away from your face and eyes. Close the lid so it snaps shut to prevent moisture loss. If the wipe falls back into the canister, the large opening allows for easy retrieval of the wipe. Reach into the large opening and grab the tail of the wipe and thread it through the small opening. If at any point you have excess wipe material, tuck it into the large opening and close the lid. Step 3. Cleaning. Prior to any disinfection, pre-clean heavily soiled surfaces. If there is visible soil, clean first to remove all organic matter, dust, dirt, blood, or other organic material, so the disinfectant can decontaminate the surface. This step is required only if heavy soil is present. You don't need to wait the contact time for this cleaning step. Step 4. Disinfection. To disinfect, there must be no visible soil on the surface. Dispense a wipe using the proper procedure in Step 2. Be sure to close the lid. To disinfect hard, non-porous surfaces, use a clean wipe to thoroughly wet the surface. Allow surface to remain visibly wet for 1 minute. Allow to air dry. For continuously active disinfection on hard, non-porous surfaces for up to 24 hours, follow disinfection directions and allow surface to air dry. If a surface treated with Sani-24 Germicidal Wipe is cleaned with other products prior to the 24 hours expiration or between applications of Sani-24 Germicidal Wipe, the protective shield may be removed from the treated surface. A reapplication of Sani-24 Germicidal Wipe would be needed to provide continuously active disinfection. Use Sani-24 Germicidal wipes on high-touch surfaces such as bed railings, bedside table and handles, overbed tables, workstation on wheels, telephone, as well as counters, sink fixtures, and handles. To use Sani-24 as a hard surface mildew stat on hard surfaces, use a clean wipe to thoroughly wet surface. Let air dry. Repeat every 7 days to inhibit mold and mildew growth. PDI is committed to providing breakthrough products for your infection-fighting arsenal with ready-to-use disinfectants and advanced technologies so that you can deliver the best in patient care.